Welcome, Jocelyn Variety Show fans. This is our Friday interview show. We'll be starting that in a few minutes. I'm Jack Newby, the Executive Director of the Jocelyn Center. Welcome to our show. A couple things going on here. As I'm sure you're aware, we're now completing our second week of being open, and things are going well. We're seeing members participate in our classes. And in fact, we will soon be increasing the class size. We still ask you, however, to make a reservation in advance. When you enter the Jocelyn Center, we'll ask you to take your temperature and sign in so we can keep track of everyone who's here in the building, and you'll get a colored sticker for the day. And then have fun in your classes. We're also still asking you, even though the state has ended the mask mandate, we're still asking you to wear your masks here. And the reason for that is, there has been a big decrease of people wearing masks. More people are meeting in large groups. Restaurants are open, businesses are open. And we deal with a very vulnerable community here at the Jocelyn Center. And we just want to wait a couple of weeks for your protection and the protection of our staff and our visitors to wear your mask for another couple of weeks, so we can get a good handle on whether there's going to be a surge with this relaxation of all the things we've been going through this past year. And it sure has been a lot. But please give our website a visit. We have our Go for Life program Monday through Thursday. We have seated yoga. We have our balanced conditioning class. We have our Eisenhower Health lectures. Those are still on Zoom. And just a lot of activities going on. Some of our groups are meeting again, our watercolor and knitting and crocheting groups. And you will soon be seeing card and board games. So a lot's coming up, and check out that pickleball if you want to learn how to play pickleball, especially now in the summer. We're doing it inside. So a lot happening here at the Jocelyn Center. We're here this morning for our Friday morning interview. We do it on a regular basis as information for members of our community, and to find out more about some of our business partners and supporters. And today we're really happy to welcome Ruth Osborne from SCAN Health Plan. Ruth, you're still muted. There you go. So that's okay. So how are you this morning?
I'm doing well. Thank you, Jack.
Good to see you.
Likewise.
So before we start talking specifically about SCAN, I think it's a good idea to remind people, and especially the seniors watching this who may be approaching retirement age, what are the things that a person should do around their 65th birthday with respect to Medicare?
So thank you for giving me this opportunity, for sure, Jack, and the Jocelyn. There's a couple things. I mean, sometimes it happens automatically when you are turning 65 because you're already on Social Security. So it's just an automated process. But for those that it's not an automated process, whether it be that you're going to be covered by an employer or you're going to be continued to be covered by a previous employer, maybe you're not taking your Social Security yet, because in today's age, there's a lot of individuals that choose to wait to take their Social Security. So it's not an automated process. If that's the case, I always tell people around 3 months prior to your 65th birthday, reach out to Social Security and find out what they need from you. If you're going to start your Medicare or if you're not going to start your Medicare on your 65th birthday. And the reason I say that is if you're going to start your Medicare, even if you're not receiving Social Security, that's fine. You can do that, but you'll need to notify Medicare of that. And then they'll tell you what they need from you if they need anything. if you're going to wait on the Medicare because you have other credible coverage, meaning you have coverage that's equal to or better than what Medicare would offer you, then you want to let Medicare or Social Security know that you're going to wait on that. You're going to postpone that. So you'll still enroll in the Part A with Medicare at 65, but the Part B, you'll just let them know that you're going to postpone that enrollment because you have other coverage through an employer or through a spouse's employer or a previous employer that is equal or better to than what you have with Medicare or what the option is with Medicare. And then Social Security will let you know what they need. And the reason for that is you don't want to risk any kind of penalty down the road for not taking it at 65.
And I think that's important because so many people now are us baby boomers. We're working past age 65, may not think about the need for Medicare, or just, I'll do it when I need it. And that penalty, as I understand, is lifetime. So for the rest of your life, you'll have to pay a penalty.
Correct.
Now, there's traditional Medicare, and that's the Part A, which is hospitalization, and Part B, which is medical coverage with doctors or those sorts of things. How does that work?
So you're absolutely correct. It's hospital for Part A, medical outpatient services for Part B. The Part A typically happens automatically once you turn 65, as long as you have worked and paid into Social Security for 40 quarters, which is equal to 10 years. And then with that being said, there's not a premium for that for you. The Part B, the medical side of it, there is a premium for that, and it typically goes up a few dollars every year. It's around $148 a month right now, but that's your responsibility to pay that, and then that pays for medical services. Medicare alone, just the basic original Medicare, is a fee-for-service plan, so you can see any doctor that takes Medicare. So it's not necessarily a network of doctors or a book that you have to look in, but everything isn't covered. You have deductibles that you have to pay, and you have a percentage that you have to pay. So for most individuals, it becomes costly, and so they look for other options.
I understand there's at least they'll pay 80%, and you have to pay at least 20% of that bill.
Correct. And that's the Medicare Part B. So the Medicare Part A for hospitalization, you have a deductible that you have to pay for hospitalization. But on the medical side of it, the Part B side of it, that's correct. You have a small yearly deductible. And then after you meet that deductible, most people understand it as like an 80-20 fee schedule. So Medicare will pay 80% of whatever the Medicare rate is. And then you, the patient, is responsible for 20%. So when you think about 20% of every doctor visit, every lab test, every outpatient surgery, that adds up for people.
Yeah, I can imagine looking at some of my own bills that I've gotten recently. So the other thing is, if a person is enrolled in Medicare, or wants to enroll in Medicare and wants to change plans, they can only do that during a certain period of time. Is that right?
That's correct. So you have what is called your annual election period. And so once someone has Medicare, they're basically subject to the enrollment guidelines, just like they are when they're working. They have like a set enrollment period every year. So it's what Medicare calls the annual election period. So once you're enrolled in Medicare, if you want to enroll in a different type of plan with your Medicare, or you want to change to a different type of plan, then that annual enrollment period is October 15th to December 7th of every year. And then whatever change you make during that time, it becomes effective January 1st. And that's for anyone with Medicare that wants to make a change. Now, when someone is, and maybe this is what you were even referring to, but when someone is first becoming eligible for Medicare, they have a different enrollment time of when they can enroll. And that's their initial enrollment period. And that they can actually enroll into their Medicare and then another plan, for example, like SCAN, which we'll talk more about in a moment, but they can enroll in another plan with their Medicare 3 months prior to the effective date of their Medicare, the month that their Medicare becomes effective, and up to 3 months after. So they actually have a 7-month window. So let's just say, hypothetically speaking, someone's Medicare starts July 1st. They have 3 months prior to that to enroll, the month of July, and then 3 months after. So they have that 7-month window.
Okay, that's good information for people to keep in mind when they start approaching that magic age of 65. Um, there is that other part of Medicare that can become very confusing for people, and that's Part D, the drug coverage. How does that work kind of generally? And then we'll talk a little bit how it would work with a, a health plan like SCAN.
So just generally, if someone just has regular Medicare Part A and Part B and they want prescription drug coverage, then they have to enroll in a plan, a Medicare Part D, like drug, they have to enroll in a separate Part D plan. And that's a plan that they would pay a premium for. And then whatever the benefits are based on that plan, that's what they would pay. But it is specifically a prescription drug plan. They may have deductibles, they may pay a percentage, they may pay a flat copay, but that is a set drug plan that's called a Medicare Part D. And someone that enrolls with Medicare, they want to enroll in a Part D when they first enroll with Medicare, whether it be a standalone prescription drug plan that's a Part D, or whether it's a plan like SCAN that includes the prescription drug coverage. And the reason for that is, once again, if you don't enroll when you first become eligible and you decide down the road that you need that Part D, Medicare penalizes you. So even if you say, I don't take any prescriptions, I don't have a need for a drug plan, take a plan like SCAN that includes it, or take your minimal coverage with a Part D plan just so that you have something, so that if down the road you need it, you're not going to be penalized for not taking a Part D when you first became eligible for Medicare.
So all good information as people approach that, again, that magic age of 65 and have to start making these decisions. And one of the decisions they're going to be making is, what kind of plan they're going to enroll in, whether it's traditional Medicare, if that works for them, or a plan like SCAN. So tell us a little bit about SCAN and the background of the company.
So as far as who we are as an organization, SCAN, SCAN actually stands for Senior Care Action Network. And SCAN was founded in 1977 out of Long Beach, California, by a group of 12 senior citizens. And it's kind of a unique story for an insurance company, but we were founded by a group of 12 individuals that put together the plan, lobbied, and went to Medicare and got it approved, long story short. We've been around, as I said, for over 40 years. We're not for profit. For several years in a row now, we've been rated one of Medicare's, one of the best Medicare Advantage plans by U.S. News and World Report. Medicare gives the health plans, I should say we earn, but Medicare gives us a star rating based on different quality measures, and 5 being the most you can receive. So SCAN has been at 4.5 stars for 4 years in a row now. And that's a huge accomplishment for us, because that basically tells our members and prospects that we're doing what's expected from us by Medicare and for our members. As I said, we're not for profit. We're based in Long Beach, so we're a Southern California plan. So when our members enroll, I think from what I hear from them, it's a good feeling in that they're dealing with someone that's right here in Southern California, so that whether it be a wildfire happening or these outrageous temperatures that we're having, they can relate. They're not talking to someone in Minnesota that may have no idea what we're experiencing here in Southern California. So they like the fact that our plan is based here in Southern California.
So tell us a little bit about what SCAN offers. And you mentioned the term Medicare Advantage plan. So that's another plan that individuals can enroll in when they enroll in Medicare.
Correct. So when they become eligible for Medicare, they have a couple options. SCAN offers the Medicare Advantage. And sometimes you'll hear it referred to as a Part C, typically just in the Medicare and You book. But someone that is new to Medicare will often ask me, what is a Part C? A Part C is simply a Medicare Advantage plan, and it's a plan that includes your medical and your prescriptions, and typically other benefits as well that sometimes Medicare doesn't cover. So A Medicare Advantage plan means that we're contracted with Medicare to offer these benefits to our members. So you're going to get everything that Medicare offers you, plus a lot of additional benefits. And this is a plan that actually Medicare pays us for you to be a member of, so that it's typically not costing you a monthly premium. It's just that Medicare's paying us to become the primary over your Medicare, so that it's not costing you anything, and it's giving you the prescription drug coverage and many other benefits to go along with that.
And what are some of those benefits? What's the advantage of the SCAN Health plan?
So the advantage of the SCAN Health plan, I mean, we offer several different plans that all fall under the Medicare Advantage umbrella. Our most popular plan is our classic plan, and that's where 85% of our membership is. And that's simply because it's been around forever, and it has no monthly premium, and it has extremely rich benefits. We also offer our Prime plan that has a $23 monthly premium, and it gives you a few additional benefits in some areas. And so when I go through the plans with someone, there's some specific questions I ask them, and if they have those needs, then I may recommend that plan for them. And then we offer plans to individuals that may be on Medicare and Medi-Cal, our Connections plan and our Plus plan. And those plans, you have to have Medicare and Medi-Cal from the state in order to be eligible for those plans. But those benefits are designed specifically for those individuals. And then we offer what's called our Heart First plan. And anyone that has a heart condition or may have any number of a certain symptoms may qualify you for that Heart First plan, and allow you to enroll any time of the year, basically. But those are the standard plans that we offer. And really the advantage of a plan like SCAN, and SCAN specifically, is that it's extremely comprehensive coverage at little to no cost to you. So rather than, going through all the benefits, but, there's no premium, no deductibles, no cost for hospitalization, for doctors, for lab, for x-rays, physical therapy, urgent care. I mean, you go down the list, there's no cost to you. There's very few areas that you'll pay a copay. It includes your prescription drug plan. We have an extremely robust prescription formulary. On all of our products, on our standard products, your insulin is a flat $25, and that's unique. It's a flat $25, even if you hit what we call this wonderful thing of the prescription coverage gap, which all the plans have. Our coverage still remains $25 on insulin. We include a routine vision benefit, preventative dental, transportation for medical appointments, chiropractor, acupuncture, gym membership, some in-home care after hospital stay, where we'll also deliver meals to you. We provide you the medical alert if that's something that you feel you need and you'd be more comfortable with. I mean, it's an extremely comprehensive benefit plan at little to no cost to you.
Well, and that's something I think a lot of people don't realize, is that traditional Medicare doesn't include vision, and most of us need that. And it doesn't include dental or hearing or a number of different benefits. So that's an important aspect for individuals to consider, I would think.
I agree. I agree for sure. And a lot of times, I think, from what I hear, the seniors, when someone's first becoming eligible for Medicare, especially, they assume that because it's called Medicare Part D, that they're just automatically going to have it. And it's not. You get your Medicare Part A and Part B through Medicare, through Social Security with Medicare, but Medicare Part D, you don't get through Medicare, you get it through private entities. So it's either through a plan like SCAN that includes your prescription drug coverage as your Part D, or you purchase it separately from a different company. So it's not, they definitely don't want to assume that it's included just because it's called Part D, because it's not. You have to take that separately.
Now, I know some plans, and I'm not sure about SCAN, so I'll ask. Some plans, as part of their medical coverage or their Part D coverage, include some common over-the-counter drugs and that sort of thing. Is that part of what your plan offers?
That is correct. It's different on each of the plans. We have a catalog that we send to our members where they're able to order over-the-counter products at no cost to them up to a certain amount. Our Medicare Medi-Cal product, which is our Connections plan, they can order out of that catalog, and they can also have the pharmacist, for example, take cough medicine off the shelf and put a label on it and get it at no cost as well. So we definitely have an over-the-counter benefit that a lot of our members use and do benefit from, because it saves them some money.
I think with some of the prices I've seen in the drugstore for over-the-counter drugs, I think it could save a considerable amount. SCAN, you mentioned, is unique. It's a nonprofit organization. As I understand, there's some educational programming or things that SCAN does for their members. Are you involved in that part of SCAN?
So the educational part of that I'm involved with, as far as this portion of SCAN, most of the medical groups that we're contracted with have educational programs that they offer to their members at no cost. And so when I say the medical groups that we work with, to just backtrack a little bit, in order for someone to have SCAN, they have to have Medicare, and then they enroll with SCAN as their insurance. But when they enroll with SCAN as their insurance, they then select a medical group. They select a primary care physician. So whatever, like, depending on the medical group they select, most of those medical groups have a very robust array of educational classes that their members have access to, whether it be, to help maintain diabetes, healthy living, whatever it might be. Absolutely. And then periodically, yes, as a representative, we do offer different educational classes in the field, whether it be, like, for example, through the Joslin Center, or at different senior housings, where we'll do like a fraud prevention class or a fall prevention class, those types of things. And those are open to anyone that has SCAN or that is looking to have SCAN.
That's another important thing, the education, keeping our seniors aware of what's out there, especially in terms of scams. That's changing every day. And fall prevention is so important now, and that's something I'll remind our members of about right now. Is we're finding that coming out of this pandemic we've been in, and individuals being isolated, they've lost a lot of muscle weight or lean body weight. They may be weaker. So fall prevention is an important thing, and keeping your exercise up is an important thing. But start slow. We don't want you to hurt yourself getting started after all this. I don't know whether you've experienced that. I know I have experienced it. Well, I want to thank you very much. Is there anything I missed in our conversation?
I don't think so. I mean, as I said, we're a Southern California plan. We're based here in Southern California. As of next year, we're going back into Arizona and Nevada. But we pride ourselves in being a Southern California plan. I mean, we'll cover you anywhere that you go for emergencies, because a lot of our members do travel. We'll cover you completely, but we're a Southern California based plan. And when we've been at 4.5 stars for 4 years. So that says a lot to our members.
Yeah, it is. That's a very important, and that's not from members, that's from Medicare. So that's kind of an outside entity or government group looking at you and making that rating. So that's very important. Well, I really want to thank you for joining us this morning. I'll ask you and all of our members to stay safe and stay cool this weekend, especially those here in the Coachella Valley. We've had record-breaking temperatures here in Palm Springs and Palm Desert, in the Coachella Valley, and it's important to stay hydrated and stay inside as much as you can. So thank you again, Ruth, for joining us and telling us a little bit about SCAN and letting our members know about Medicare and the things they need to think about as they approach Medicare or want to change plans during that open enrollment period. So we really appreciate your taking the time and talking with us this morning.
Thank you so much for the opportunity. If anyone, whether you're a SCAN member or you're a prospect, you can reach me. I'll give you my cell phone and website and email as well, but there's plenty of different ways you can reach me, but the quickest way is my cell phone. And it's a different area code only because I've had it for 20 plus years and I've been selling insurance for 20 years. So I've kept that number. But it's area code 661-609-3602. 661-609-3602. And then my web page is my name. So Ruth Osborne, R-U-T, no, let's go back. Let's give you the web page first. So it's Scan Health Plan, www.scanhealthplan, just like it sounds, .com/Ruth Osborne, RUTHOSBORN. And that takes you directly to my page with Scan. You can, on that page, you can see meetings that are coming up. You can see the benefits for the area that you live in. It gives you a lot of information there. You can look for providers. But as far as, to contact me directly, you can call me, you can text me, whatever works better for you. And like I said, whether you're a Scan member and have questions or want to refer a friend, or whether you're a prospect, please feel free to jot down my information and reach out to me.
And why don't we hear that phone number one more time?
Okay, it's 661-609-3602. And
Okay,
thank you so much, Jack, and to the Joslyn Center for this opportunity.
you're very welcome, and we look forward to seeing you here and maybe getting you scheduled for one of those educational lectures.
Sounds good. Thanks so much.
All
Have a
right.
great weekend.
Thank you. Everybody have a great weekend and stay safe and stay cool. Thank you.
Thank you.